Hi, everybody. I'm Dr. Ardis, host of the Dr. Ardis Show, and I'm so excited about this special presentation and podcast we're going to do today. A lot of people around the world have asked me to do a presentation highlighting what are the natural antidotes and solutions to a scenario that affects millions of children, adolescents, teenagers, and adults in America. You're going to see some of those statistics here. This is everything you need to know about ADD, ADHD. What are the problems with the most prescribed medications for this condition for young adults, teens, and then what are the natural published solutions that are known to science that could be alternative therapies for you or your loved ones if you yourself find yourself struggling with attention and focus and memory and recall. That is what this show is all about. I'm going to be presenting to you a PowerPoint presentation. And remember, if you find this information advantageous and you yourself are excited about it, you want to apply this information into your life, you can download the entire PowerPoint I'm about to take you through with all the research scientific papers, URL web addresses for direct access and linkage. You're going to go to the resources tab at the drardisshow.com and you're going to see the ADD, ADHD presentation there. You download it. It's a PDF, save it, share it, email it, give it to whoever you want. My goal is to help remove the burdens that affect so many people, and a focus, memory is a huge issue for many. So let's dive into that PowerPoint. Remember, the resources tab at the drardisshow.com has this entire PowerPoint here for you to download. And then also don't be afraid to share the episode, share the recording with people as I walk you through all that is published about ADD and ADHD. All right, let's dive in. Here we go. This is a QR code. You can use this QR code to scan. A little window will show up on your internet screen that allows you to put in your email address, and it just allows us to know who to notify when our next presentations are coming up. And we do one unique show dissecting and destroying the narrative around a specific health condition once a week. So if you would like to be notified of these presentations, please scan the QR code, put in your email address, and we will notify you. All of our presentations and PowerPoints and our episodes are free. So join us. All right, this is the Cleveland Clinic. Let's dive in. Cleveland Clinic, in their summary of ADD, ADHD, they tell you attention deficit hyperactivity disorder, ADHD, is one of the most common childhood neurodevelopmental disorders. What do the children with ADD have difficulty with? This also applies to adults. They have inattention issues, hyperactivity, and impulsivity. And kids usually receive a diagnosis during childhood, and the condition often lasts into adulthood. However, they say effective treatment is available. I'm about to show you what that effective treatment is. So what's the difference between ADD and ADHD? And we thought this was a good idea to highlight for you. Do you know that ADD is no longer a diagnosis? They don't even write this down anymore. It's actually only ADHD. So as you read here from the Cleveland Clinic, providers used to call the inattentive presentation type of ADHD as attention deficit disorder, or ADD. In 1994, the American Psychiatric Association officially changed its name. Providers now call all forms of ADHD attention deficit/hyperactivity disorder, whether or not there are symptoms of hyperactivity or not. So it doesn't matter. They're all ADHD now. This is the University of Utah's Health Magazine Online. Why is adult ADHD on the rise, they ask? And this was published in June of 2024. We are in 2025 right now as of this recording. So it is on the rise. Let's read what they are stating in this article. Is COVID-19 to blame for the rise is the section of this article. In 2024, it's convenient to blame everything, they state, on a national name for the rise is the section of this article. In 2024, it's convenient to blame everything, they state, on a national pandemic, which we did find during the pandemic. However, with a tidal wave of new adults presenting with symptoms of ADHD, Tuller considers the merit of 3 of COVID-19's biggest impacts. This is his summary. Number 1, there was a loss of structure in our lives that led to more ADHD in people. So read the first statement. Having structure can be a coping strategy for those who live with undiagnosed ADHD. Well, people that had college students, they reference, people who had office jobs with timed 8-hour shifts, they saw that all of this was helpful to people And when he took that away by locking down everybody, it created loss of structure, leading to what he claims, or she claims, is an added influence from COVID-19 on increased diagnosis of ADHD. Also, COVID-19, they state, cognitive dysfunction. Those diagnosed with COVID-19, and particularly long COVID, have struggled with new onset and exacerbated cognitive dysfunction, says Tuller, who has examined the well-established and growing data on the subject. I just want to remind everybody at this moment, I wrote all about the psychiatric mental impact of COVID-19, the spike proteins of COVID, you name it, in my book, Moving Beyond COVID-19 Live. I talk about these in my book, Moving Beyond COVID-19, Restoring Hope and Help for Humanity. So get the book, share it with everybody else. There's a reason why people are having these cognitive dysfunction scenarios, including ADHD. And then they state that with COVID-19, social media awareness. So they said the explosion of ADHD-related content on social media has resulted in an increased awareness of the disorder. So this is claiming, as more people are talking about ADHD on social media platforms, more people are doing self-assessments and going, you know what, I think I have it. This is propaganda, by the way. All right, so let's keep going. What's driving the rise in ADHD diagnosis among children and adults? This is an article from Syracuse University College of Arts and Sciences. And I want to highlight the very first paragraph of their article. Attention deficit hyperactivity disorder is the most commonly diagnosed behavioral disorder in children. So it's number one. And the numbers are only expected to rise. The CDC reported that in 2022, over 7 million, or 11% of all U.S. children aged 3 to 17 years were diagnosed with ADHD. And that was an increase of 1 million kids compared to the number in 2016. The elevated numbers aren't limited to children, Syracuse reports. According to a 2021 report in the Journal of Managed Care and Specialty Pharmacy, 8.7 million adults in the U.S. have ADHD. 8.7 million. All right, this is Healthline Magazine, an online, a very reputable journal, supposedly. This is an article titled ADHD Treatment Options for Children and Adults. ADHD, first sentence, treatment depends on individual needs and the severity of some symptoms. It may involve behavioral therapy, coaching, and prescription drugs. The same strategies may benefit children and adults. All right, so here's your 2 drug options they're going to tell you, and that they highlight. One are called stimulant drugs. Stimulant medications reduce the reabsorption of brain messengers like dopamine and norepinephrine. So these drugs called stimulants block your body's ability to absorb dopamine and norepinephrine, which are stimulants. And as your body doesn't use them up, the reservoir or amount of these hormones should be continuing to build in the tissues of your brain and body, which they say will increase their levels in the brain. They are commonly used for adult ADHD symptoms. Well, what are some of the common stimulant medications for ADHD? Well, I want you to look at all the names. We have them in a red box on the screen. Amphetamines, dextroamphetamines, lisdexamfetamine, methylphenidate, dexmethylphenidate. We're going to talk about methylphenidate a lot because it's one of the most prescribed drugs with a brand name. You may not recognize that name, but you know its brand name is Ritalin. We're going to actually highlight all of Ritalin's side effects. All right, non-stimulant medications. These are the alternative drugs for some people with ADHD. A healthcare professional, Healthline reports, may consider a non-stimulant medication when others' treatments have not decreased symptoms or if side effects are difficult to manage. You're about to find out just how many side effects they have to attempt to manage any medical doctor prescribing a stimulant drug or a non-stimulant drug. Atomexetine is the first drug we want to highlight. That is a generic name. We're going to show you the actual brand name here in just a second. Guanfacine ER, clonidine ER are other ones that are considered non-stimulant. What these drugs actually do to you. This is methylphenidate, otherwise known as Ritalin. In fact, you'll see the brand names highlighted there. Adhensia XR. If you click the 12 where it says show all 12 brands, you'll see Ritalin is actually one of them. So this is methylphenidate is Ritalin. What is methylphenidate? You'll see at the bottom. It is a central nervous system stimulant. It affects chemicals in the brain and nerves that contribute to hyperactivity and impulse control. Then they tell you flat out, it's used to treat attention deficit disorder, attention deficit hyperactivity disorder, and narcolepsy, which narcolepsy is when you just fall asleep all the time when you should be awake. All right, this is the black box warning from drugs.com. And I want to highlight for you a few things on here that you should be aware of if your kid is put on this drug, Ritalin, for ADHD, or you yourself. Warning, abuse, misuse, and addiction, methylphenidate, Ritalin, have a high potential for abuse and misuse, which can lead to the development of a substance use disorder, including addiction. Before prescribing methylphenidate, assess each patient's risk for abuse, misuse, and addiction. Educate patients and their families about these risks, proper storage of the drug, and proper disposal of any unused drug. Throughout Ritalin treatment, reassess each patient's risk of abuse, misuse, and addiction, and frequently monitor for signs and symptoms of abuse, misuse, and addictions. Why? Go up to the second sentence in this diagram, which is the only one I skipped. Misuse and abuse of central nervous system stimulants like Ritalin can result in overdose, and this risk is increased with higher doses or unapproved methods of administration, such as snorting or injection. Just so you know, they know this drug can lead to overdose. That's important. Now let's get into some of the more commonly published known side effects of Ritalin. You guys should be very excited about this. Now you'll see a common side effect. Up to 10% of people, 1 in 10 people on Ritalin, children, adolescents, will experience lethargy, which is extreme fatigue. They will develop, 1 in 10 people on it will develop ear infections. They will develop fatigue. They will develop ear and labyrinth disorders. Let me give you an idea of what those are. Vertigo issues. How about tinnitus or tinnitus? How about motion sickness? How about deafness? All right, let's keep going. How about the psychiatric effects of Ritalin? Now, Ritalin is a nervous system stimulant, supposedly. I want you to look at the very common psychiatric side effects of Ritalin. For every child, adolescent, teenager, and adult put on Ritalin, they know there is a very common amount of side effects already known about this drug that's occurring. Very common means it's in over 10% of all people that take the drug during human trials. What did they publish about Ritalin? Did you know that Ritalin is published to cause 27.9%, just round up, that's 30% of everybody that takes Ritalin, they will develop a psychiatric disorder and be diagnosed with the psychiatric disorder. Not because they have a psychiatric disorder. The drug causes 1 out of 3 people on Ritalin to develop and later be diagnosed with a new psychiatric disorder. What are some of these? Anxiety disorders, schizophrenia, bipolarism. I'm not joking. Did you know erectile dysfunction is called a psychiatric disorder? All right, so these are all just examples of psychiatric disorders. Psychosis, manic depression, anxiety disorders. 30% of everybody on Ritalin will develop that. I thought you should know that. Did you know 13% of everybody will develop insomnia? Did you know that up to 1% of everybody on the drug will develop hallucinations, anger, ideations, and thoughts? 1% will develop tics, worsening of pre-existing tics, or Tourette syndrome. Did you know that Tourette syndrome was a side effect of Ritalin? All right, let's look at their metabolic side effects published on drugs.com about Ritalin. So the drug manufacturer Ritalin has published more than 10% of all people will have very common side effects of decreased appetite in up to 30% of everybody. And then metabolism and nutrition disorders in 11% of all people. Gastrointestinal diseases. Check out this number. It's very common for all people on Ritalin. 1 in 4, 25% of all of them will develop gastrointestinal disorders. Let me tell you, if you took gastrointestinal disorders and put it in Google and asked for a list, let me tell you what you're going to read. You're going to read Crohn's disease, ulcerative colitis, polyps, celiac disease, IBS. These are the scenarios. 1 in 4 Ritalin patients will develop gastrointestinal disorders, not because of they have a genetic predisposition from their family for this. No, the drug Ritalin causes GI disorders to be diagnosed. Dry mouth in 1 in 5, it's 21%. Nausea in 12%. Vomiting in 10%. Sounds like Ozempic and Wegovy. 1 in 10 will be vomiting as a result of the drug. Okay, so food poisoning creates vomiting symptoms. So what you're learning is this Ritalin creates food poisoning symptoms. Okay, well, it might be toxic to your body. Nervous system. The nervous system, your brain, nerves of the body. Did you know it's very common, it's listed, that more than 10% of all people on Ritalin will develop a nervous system disorder? Did you know that more than 23% of all people on Ritalin will develop a nervous system disorder? Do you know what nervous system disorders are? Copy nervous system disorders, put it into Google, add the words list of. And you will see that the nervous system disorders include Parkinson's, MS, Guillain-Barré syndrome, Bell's palsy, Alzheimer's. These are all nervous system disorders that are caused by Ritalin. Not because they inherited the genes that cause it. The drug causes 1 in 4 people on Ritalin to develop a nervous system disorder. How many of you were told that 1 in 4 people on Ritalin will experience headaches as a continuous side effect of the drug? I'm not sure not being able to focus in school and adding a migraine headache every day is a good idea in 1 in 4 people diagnosed and given Ritalin. What about respiratory symptoms? Check this out. You put your kid on Ritalin, and within a few weeks, your kid starts developing respiratory infections. Did you know 20%? Did your medical doctor tell you that 1 in 5 people on Ritalin will develop respiratory infections like pneumonia? Did they tell you that? Ask your doctor if pneumonia is right for your kid when they put you on Ritalin. Endocrine. Up to 10% of all people on Ritalin will develop, read the words, published by drugs.com, reproductive system and breast disorders. Let's break these two down. That means 1 in 10 on Ritalin won't be able to have a baby, or they will develop miscarriages in every pregnancy just because of Ritalin. Breast disorders, what are some of those? Breast cancer, cystic fibrosis. Ask your doctor if cystic fibrosis is right for your kid when they put them on Ritalin. And then how many young people and young adults are put on Ritalin, develop breast disorders, cystic fibrosis and nodules, and then are told they have the fact they were put on Ritalin for focus during college, and now they're telling you. Musculoskeletal wise. Did you know that more than 10% of all people on Ritalin, 14% to be exact, are published to then have, because of the drug, musculoskeletal and connective tissue disorders? Well, what are some of those? I don't know. Have you ever heard of scoliosis? Have you ever heard of plantar fasciitis in the feet? Have you ever heard of tendinitis? Have you ever heard of arthritis? Spinal stenosis? These are all musculoskeletal disorders. Fibromyalgia, another musculoskeletal disorder. What about cardiovascular? Did you know more than 10% or up to 10% of everybody on Ritalin, your child, your teenager, they know 1 in 10 will develop palpitations of the heart, tachycardia, cardiac disorders, name the list. How many cardiac disorders are there? Vascular disorders. Oh, strokes and aneurysms. Thank you. Arrhythmias, hypertension, hot flush, changes in blood pressure and heart rate. Ask your doctor if changes in heart rate and blood pressure are right for your child or cardiovascular disorders, because I want to tell you something. If you've ever been a woman in labor, giving birth to a baby, they have this monitor on your belly the whole time you're in labor. And they will tell you if the heart rate changes or the blood pressure changes up or down, it's an emergency. We got to do a C-section. All right, well, what is it in a kid that's already born? Can't always be positive to have tachycardia, palpitations, and changes in your heart rate. Good or bad, up or down. What about your skin? Did you know up to 10% of all people on Ritalin will develop a rash? Pruritus, urticaria, rashes all over their body, scalp or hair loss and alopecia, dermatitis, this is what it looks like, skin and subcutaneous tissue disorders. I guess that's right for everybody. And then check this out. This is probably the most disturbing side effect I saw in the research on Ritalin. Did you know that under the immune system section of side effects of Ritalin, it is published that it is very common. 45% of everybody that gets put on Ritalin, regardless of age, child, adolescent, teenager, adult. Did you know that 45%, that's 1 in 2 of all individuals diagnosed with ADHD who are then prescribed Ritalin, the drug will cause 1 in 2 to develop infections and infestations? Well, I want to highlight something for you. Go download the PDF. I'm not even going to show you here. Do you know what the difference is between an infection and infestations that occur in half of all people that are put on Ritalin? Infections by science is defined to mean in your body, you have now a bacteria, a fungus, or a virus inside of you. An infestation is a science term which only has one definition, meaning you now are riddled with parasite infections in your body. Okay, listen, 1 in 2 kids, 1 in 2 adults, 1 in 2 teenagers who are put on Ritalin will develop a bacterial, viral, fungal, or parasite infection. Ask your doctor if bacterial, viral, fungal, and parasitic infections are right for your child when they prescribe Ritalin. Did you know that stimulants like Ritalin, it is published, this is from drugs.com about Ritalin from the Ritalin page, stimulants have caused stroke. Let's start this over. Let's replace the word stimulant with Ritalin or methylphenidate, which is its generic name. Ritalin have caused stroke, heart attack, and sudden in certain people. Did your medical doctor tell you that when they prescribe Ritalin to your 5-year-old in kindergarten because they can't focus during crayon time? Then it states, get emergency medical help if you have signs of a heart attack or stroke while taking Ritalin. Chest pain spreading to your jaw or shoulder, sudden numbness or weakness on one side of the body, slurred speech or feeling short of breath, all ridiculous. I don't think these risks warrant prescribing Ritalin to the millions of kids around the world, and I definitely don't like that there are school systems, independent school systems in every state, which are actually being incentivized by the state for the amount and percentage of kids that are diagnosed with ADHD and then put on these prescription medications like Ritalin. And then the school gets extra money for those. Yeah, that's true. Let's look at the next drug that they use for ADHD, atomoxetine. Brand name is Strattera. This is used for ADHD. You'll see in the first sentence there, it's a class of drug called SNRI. But I want to read to you what the black box warning is from the FDA. This is the most severe warning to all people prescribed this drug. Ideation in children and adults is the black box warning. So this means kids can't focus in school. So you go give them a drug to make them focus more, but the drug itself is going to cause the kid in ideations. Atomoxetine increased the risk of ideation in short-term studies in children or adolescents with ADHD. I need to highlight something in that statement that's very specific. It doesn't say in long-term studies. It says in short-term studies. This means in a very short time in which we give children these drugs for ADHD, this type of drug, atomoxetine, actually increases the rate of suicides and actions. Ask your doctor when they say your kid's not focusing in school the whole time to his teacher. Ask them if giving them a drug that increases their want to not live life is a better alternative. Patients who are started on therapy should be monitored closely for thinking and behavior, clinical worsening, or unusual changes in behavior. Families and caregivers of those put on this drug for ADHD should be advised of the need for close observation and communication with the prescriber. Well, any parent giving their kid this drugs or any spouse giving their loved one this drug, you better make sure you're watching the guy every day and then communicating with the prescriber medical doctor who it is that prescribed the drug if their behavior is getting worse. Did you know this drug causes 1 in 4, 23% of all people, an increased heart rate and increased blood pressure, and 1 in 5? Remember, these are stimulants. Did you know that up to 21% of all people put on this drug? Pay attention, spouses. If your spouse can't focus and he's a male. Did you know that 1 in 5 people on this drug can't get an erection? Erectile dysfunction is caused by the drug. Did you know up to 10% of all people on this drug will experience fatigue? And I want to highlight here that after the human trials were over on this drug, many people had sudden occur while on this drug, and that was reported by family members back to the pharmaceutical company, but the trial was already over. So they actually list here, we don't really know that percentage. It wasn't during the trial period. Ask your doctor if sudden do. Nervous system, very common. 19% of all people on this drug will develop headaches. Another 11% will be sedated or somnolent. Up to 20% of all people on this stimulant drug will actually experience insomnia. Or look at this, after the trials were over, some people completed as a side effect listed on drugs.com. That means they're dead. Let's look into vitamins and minerals for the last 10 minutes of this. Remember, you can download this. If I don't cover all the slides, I may go through this quick, trying to shorten these down, but you have all the information at the resources tab at the Dr. Ardis Show. Just download it. It gives you all the doses and everything from the studies. These are vitamins and minerals for better results without any of those published side effects I just showed you of stimulants from prescriptions. Let's first dive into the effect of vitamin D and magnesium supplementation in the International Journal of Preventive Medicine, published in 2020. They looked at vitamin D and magnesium supplements in behavioral problems in children with ADHD disorder. And what did they publish? Well, they took participants, 66 of them, and randomly allocated to either a supplement group of 33, half of them got vitamin D and magnesium, and then the other half got nothing. Children in the supplemented group received vitamin D in the form of oral pearls and magnesium in the form of oral tablets. Children in the placebo group received vitamin D and magnesium placebos, which were similar in appearance, color, and taste to these supplements and produced in the School of Pharmacy at the University of Medicine Scientists in Isfahan. Now, in this study, I need y'all to pay attention here. I just went through all the horrible side effects of Ritalin. Both groups of people, placebo and those given vitamin D and magnesium, both groups were on Ritalin the whole time. There's Ritalin. After 8 weeks, the vitamin D level increased significantly in the group that was supplementing with vitamin D. The blood level of magnesium increased in the intervention group compared with the placebo group significantly. Both vitamin D and magnesium levels in the blood, when checked 8 weeks later, was way higher in the supplemented group. Serum vitamin D level, blood vitamin D level, and magnesium levels were changed significantly in the supplemented group. Supplementation with vitamin D and magnesium caused a significant decrease in conduct problems score. They also saw a decrease in social problems score. They saw a significant decrease in their anxiety and shy score. And they saw, this was in the intervention group compared with the placebo group. So if you want a child or an adult to see improvements in their social problems, their anxiety and shyness, and their conduct, ask your doctor if vitamin D and magnesium is right for you, because it's already been proven in science. Vitamin D affects various brain functions directly through its nuclear receptors. Experimental and in vitro studies and the lab studies revealed that vitamin D involved in several pathways in the brain includes the manufacturing of neurotrophic agents or chemicals that create a normal brain function, regulations of neurotransmitters, the chemicals that send information. It's neuroprotective. It protects the brain from free radicals, chemicals, toxins, and it balances out the nervous system's immune system function. I won't even read the next statement. Remember, you can actually look at all this later, download the entire presentation. I may hit some highlights here. Magnesium has an important role in regulating various brain functions. Go to the bottom. It has previously been shown magnesium might be useful as a therapeutic agent in the treatment of ADHD. Conclusions: vitamin D and magnesium supplementation in children with ADHD was effective on conduct problems, social problems, anxiety shy scores compared with the placebo intake, but did not affect psychosomatic problem scores significantly. So if the kids are complaining of, my stomach always hurts, but it's just a mental thing, they didn't see really improvements in that, but everything else they did. Let's look at the psychopharmacology bulletin. They're looking at omega-3 fatty acids and inositol in a randomized double-blind controlled clinical trial for individuals treated for bipolar spectrum disorder in children ages 5 to 12. What did they find? They found a lot. They found that 69 participants signed consent forms, enrolled in the trial, and then they gave these kids either omega-3 fatty acids or inositol, which is a B vitamin, or a combination of the both, and 52 were exposed to the treatment and 27 completed the 12-week study. This is just in 12 weeks. So what did they find? You can read this later. I'm going to continue. I want you to look at the graph. You're going to see improvement in points. This is for antidepressant response and anti-manic response in bipolar individuals and kids 5 to 12. Do you have kids who have swinging moods, can't focus? This info is for you. Look at the green bars, blue bars, purple bars. Green means that's the group of kids that only got omega-3 fatty acids. The blue group got inositol, a B vitamin alone. The purple group got omega-3 and inositol. Look at how much improvement percentage-wise there was in overall manic and depression states when you combined omega-3s and inositol together. And you see it again here with the anti-anxiety response. There is a much better increase in lowered anxiety in the omega-3 fatty acids and inositol supplemented groups. It had a massive antidepressant effects, and they highlight that here. Those receiving the combination treatment also had the highest rates of response when examining those with 50% improvement on these different various scores. I'm going to skip some of these. I just want you to see, if you want to go back and read those, you will see the improvement there by those supplements. Now let's dive into iodine deficiency in children with ADHD. 89 school children who were referred to the psychiatric outpatient unit of this hospital. These are the groups. They divided them into different groups based on their diagnoses. You'll see anxiety. You'll see ADHD with hyperactivity and impulsivity. Unlike other previous studies, such as screening for iodine deficiency in the general population, in these school children and in their intelligent functions in the iodine deficient groups, our study aimed to measure the actual amount of iodine deficiency contributing to those who have a lack of attention, lack of comprehension, lack of perception, as well as to assess the effect of iodine deficiency on learning disorders. In our study, a significant negative correlation was detected in the hyperactivity section of these scores with urinary iodine levels. The more iodine coming out of the body, the more hyperactivity we saw. So the more iodine in the body, the less hyperactivity scores. That is the negative correlation. Iodine. Ask your doctor if iodine's right for you. This is another vitamin D supplement study on the brain mapping and behavioral performance of children with ADHD. This is a double-blind, randomized clinical trial. This study was implemented on children with an established diagnosis of ADHD who received multi-session neurofeedback therapy. They're already receiving neurofeedback. For those of you who know what that is, you should know what it is. The intervention and control groups received 50,000 international units of vitamin D3 capsules and placebo, respectively, once a week for 2 months. So each week, they were given 50,000 international units of vitamin D. All of the vitamin D3 treated children showed a significant increase in vitamin D levels and calcium levels compared to the other groups, or at the beginning of the trial, called baseline. There were statistically significant decrease in the treatment group about theta relative power, theta beta waves in the brain, and theta alpha power ratios within 2 eye conditions. All the changes were significant within the eye open state in the treatment group. There is a significant relationship between Connor scores and some brain waves improvement and theta to beta power difference scores. What does all that mean? When you combine vitamin D3 supplements and neurofeedback, they saw increases in the blood level of the vitamin and reveal favorable electrophysiological results in children with ADHD when they took vitamin D. Now let's look at the blood work of ADHD pediatric groups, and they're looking at homocysteine, vitamin B12, vitamin D, ferritin, and iron levels. The results of these models include that the ADHD group had a significantly higher odds ratio for homocysteine and for iron. The odds ratio that for every 1 unit more of iron, they saw a decrease in these individuals with ADHD symptoms. This tells you how important iron is. In the ADHD group compared to the hyper group, both vitamin B12 and vitamin D had lower odds ratios, so we need more of those. The negative coefficient values observed for both vitamin D and vitamin B12 imply that elevated levels of these vitamins, higher vitamin B12, higher vitamin D, are associated with a lower likelihood of ADHD diagnosis. Ask your doctor or ask your school teacher if vitamin B12 and vitamin D might be right for your kid who can't focus in school. We're going to skip this here because they are just confirming that vitamin D directly correlates. Read the last sentence highlighted on the screen. This shows that ADHD children with lower vitamin D levels have higher levels of hyperactivity behavior and inattention. What were their conclusions? Individuals with ADHD have significantly elevated levels of homocysteine, a free radical, increased iron and ferritin, while vitamin B12 concentrations are significantly lower compared to children with normal development. This study clarifies the significance and specificity of these biochemical markers in your bloodstream. Vitamin B12 is important. Vitamin D is important. This is our vitamin D3 supplement. We just highlighted this for ADD and ADHD. They published that up to 50,000 international units every 2 weeks. Well, I want you to know, look at the dose. One capsule of our vitamin D3 has 5,000 international units. You would have to take 10 of those over a 2-week period to get to the same amount you saw in these research studies. This is our magnesium complex. We showed you the benefits of magnesium and the doses there. We recommend at least 1,000 milligrams of magnesium for all adults, 500 milligrams every day for children. Iodine from kelp, there's your 500 micrograms. One capsule of iodine should be enough for those of you looking for support with ADD, ADHD. And then this is our Doc's Healthy Kids. Anybody you know that has ADHD and is a child, you should actually make sure you give them this supplement. Why? Vitamin B12 is in it, all natural sources. Vitamin D3 is in it, magnesium is in it, and iodine is in it. So all of these we just highlighted that have shown, proven to improve your focus and attention in children and adults are in our Doc's Healthy Kids Daily Chewable. And get excited because we're about to release soon our Doc's Healthy Adults multivitamin. It's going to be amazing. You'll love it. Don't forget about our book, Moving Beyond the COVID-19. This is where you can order it. And very soon, in the next few weeks from this recording in 2025, the Audible version, the electronic version, and the Spanish version in print are all available. It's going to be very exciting. Make sure all your loved ones know about it. If you like listening to books, get the Audible version if you haven't read it yet. There's so many antidotes in there. Remember to scan this QR code if you liked what you learned, want to continue to get updated when we're doing new information and new podcasts and new presentations. I am Dr. Ardis. This is the Dr. Ardis Show, and I cannot wait to see you next week on the Dr. Ardis Show. God bless you.